Personal and professional importance of telehealth during war. Healthcare professionals have an ethical and professional responsibility to assist with healthcare during a humanitarian crisis. There are many opportunities to learn from previous experiences with humanitarian efforts and improve care and support. While doing research on this topic, I learned that telehealth technology can be utilized in humanitarian crises to boost capacity and optimize resources. Telehealth is defined by Nelson and Staggers as the use of electronic information and telecommunication technology to support long-distance clinical health care, patient and professional health-related education, public health, and health administration. When there is a humanitarian crisis such as war, geographic and safety concerns can limit the ability to provide in-person support. Advanced technology has the ability to support humanitarian healthcare delivery. Some examples of telehealth technology that is being used to support healthcare during the war in Ukraine includes digital data gathering and the sharing of health information. The lack of medical record accessibility creates a gap in healthcare delivery. Digitally collecting data and ability for that data to be accessed and shared across healthcare systems and borders helps to improve patient safety, continuity of care, and patient outcomes. Epidemiological surveillance and disease prevention results from ongoing data analysis and the sharing of information that can track and trend the healthcare needs of refugees. The epidemiological data that is collected helps to quantify needs, identify interventions, implement disease prevention methods, and will help to guide population health programs during a crisis. As many refugees flee the ravaged Ukraine to neighboring countries, there is an increased risk for vaccine-preventable diseases, which would add to the existing humanitarian crisis and limited healthcare resources. Digital data services allow for the tracking of vaccine administration and identifying areas and populations that are at an increased epidemiological risk. Telehealth technology also helps to improve communication among healthcare providers in addition to patients. With technology, patients would be able to access their healthcare information from any location. Healthcare providers would be able to use telehealth to send important information to patients, such as where they can receive care and any pertinent health alerts. In addition, interpreters are easily accessed through telehealth services. Telehealth has the opportunity to create a safer environment by limiting mobilization. Healthcare providers are able to volunteer services to those providers in Ukraine and while remaining safely out of the war-impacted area. Patients can utilize telehealth remaining in their home and avoiding the increased risks associated with traveling to their healthcare provider's office. Mental health and psychological support can be provided to those in the war zone and to refugees through telehealth services. Healthcare providers within areas directly impacted by the war can receive just-in-time education and guidance from remote specialists. This is especially helpful for those providers who do not specialize in trauma. Remote care delivery prevents the influx of healthcare systems. Remote care delivery prevents the influx of patients to healthcare systems by managing care that can safely be delivered remotely, freeing up local resources for emergent needs. Care delivery through telehealth services will continue to grow into the future and help to bridge the gap when there are crises such as war.